but 23% of the population in Indiana still smokes. As a faith community, we don't look at smoking itself as a moral issue. But what becomes a moral issue in Indiana is the tobacco companies and their marketing at $425 million a year. While we are gathered here today, one person in Indiana will die of a smoke-related disease. Now, what does that cost us? When we look at Medicaid in Indiana, one figure, $487 million of Medicaid is spent on tobacco-related diseases. So we look at it economically, tobacco is not a good thing for Indiana. Morally, the tobacco industries have been very deceptive with who we are as a people. Is tobacco addictive? Well, not only addictive, but the tobacco industry finally confessed that they were putting more chemicals into the tobacco, into the cigarettes, into the products to make them more addictive. And what is their market audience? And have you been to a convenience store to see the products that are on the shelf? The bright pink cigarettes for girls, fashionable. A tobacco culture that is endangering us. And I think we are winning this battle, but we need your help. And one of the agencies of state government is the Indiana Tobacco Prevention and Cessation Agency. It's independent of the other state agencies. It's housed in the Department of Health, but it acts independently, financing groups like here in Hamilton County to help bring about a smoke-free workplace in Indiana. ITPC, according to the CDC prevention in Atlanta, says that Indiana should be spending around $78 million a year to combat tobacco. The state of Indiana receives $125 million a year from the tobacco settlement of the early 90s. And part of that must go to tobacco prevention and cessation programs like ITPC in all the counties that work with that program. Unfortunately, the state of Indiana likes that money, and especially likes that money in recession time. I've seen that go from $32 million a year being financed when you saw all the anti-tobacco billboards, radio spots, television spots that aren't there anymore to combat big tobacco. Right now in the state budget that's being discussed when the General Assembly gets back together again, $9.23 million is being advocated for ITPC. And I would like you to give a call to Senator Kenley. Say, Senator, we need ITPC as a separate agency of state government so it can work with the volunteers across the state. And Senator Kenley, don't touch the $9.23 million. We need every dollar of it to combat that $425 million that the tobacco industry puts in to Indiana to convert new smokers. That's what I'm here about today. And I ask your support in supporting ITPC. The faith communities are behind this. The health communities are behind this. The chamber is now on board. It's time in Indiana that we went smoke-free.